Pain after surgery is totally normal and expected, but it is important that you manage your pain levels to keep active in your recovery process. Your doctor may prescribe strong pain medications known as opioids or narcotics to help you manage your pain. Not all pain medications are opioids, so make sure to ask your care team if you are uncertain about the type of medications you have been prescribed in the past. Some examples of opioids are oxycodone, Percocet, Dilaudid, and Tramadol, to name a few. Make sure your surgical team knows if you were on an opioid before and the doses that you were on if you have taken the opioid on a regular basis for more than 90 days. Also, make sure that you are clear with your surgical team about who is prescribing opioids for the first 90 days after surgery, or if you have a controlled substance agreement prior to surgery. Opioids can be very helpful in treating pain, but only if they are taken as prescribed by your care team. Some people like using the analogy of a chainsaw. Very helpful to use to cut wood, but only if used as manufactured with all the safety precautions in place, and can be very dangerous when not used as instructed. Before taking your prescribed opioids, it may be helpful to understand how they work and how to manage their usage. Your brain naturally creates endorphins. Endorphins are chemicals that release feelings of happiness that help reduce pain signals. When you're experiencing high levels of pain, your brain may not produce enough endorphins to relieve the pain. This is where opioids can help. Opioids work by creating artificial endorphins in your brain to help fight pain. These artificial endorphins block pain signals, lower stress levels, and release feel-good messages from your brain. Using opioids as prescribed will help you move around and speed your recovery from surgery, but can be harmful if not used as recommended. This is why Geisinger Proven Recovery has both the care team and the patient sign a compact committing to follow guidelines that help for a successful recovery. Some guidelines for opioids include: do not take more than you're prescribed. Taking more means you will need higher doses to feel the same effects. This is why we recommend you do not take any opioids prior to surgery. Or if you have to limit their use, prior opioid use results in slower recovery, more pain after surgery, and other complications related to opioid use like nausea, constipation, and confusion. Additionally, if you take more than prescribed, you are at risk for respiratory depression, which means you could stop breathing, leading to death. So please only take as prescribed and reach out to your doctor with any questions or concerns. For this same reason, many doctors recommend only taking one opioid at a time. Do not mix opioids. Another caution for opioids is that they can become addicting if used over a long period of time. Many doctors will want you to be off all opioids after 12 weeks or 90 days after surgery to avoid addiction. However, using opioids for a short time is not addicting. Opioids are not the only way to control pain. Other techniques that can help you manage pain include icing and elevation. Ice reduces pain by reducing swelling and can be applied in several ways, including an ice pack, frozen fruit or vegetables, or a cryotherapy device. When using ice, make sure to place a small towel between the ice and your skin. Elevation is also important to keep swelling down. Maintain any precautions given by your doctor, but elevating can keep the swelling down, which can reduce pain. It is good to walk around safely to keep the blood flowing, but it is also important to try and control the swelling with ice and elevation. Again, it's important to stay active in your recovery, and controlling pain can help. Follow your care team's instructions regarding pain and medication management, and contact them with any concerns or questions. We wish you a successful recovery.